Hey everyone, welcome back for another deep dive. There's some topics kind of like whispered about, like shrouded in this mystery.
Mhm.
Fluoride is definitely one of those things. It's in
Mm.
our water, toothpaste, even some of our food.
Mhm.
But is it this like miracle worker for our teeth, or is there something else going on?
Right.
That's what we're looking at today. You've
Yeah,
sent us a ton of articles about fluoride, and it seems like you're really curious about the safety of it all.
for sure.
And honestly, that's a great place to start because when it comes to something we're using every day, feeling good about it is really important.
I couldn't agree more. I mean, there is so much information out there, it's easy to feel overwhelmed.
Right.
But as someone who, has been studying dentistry for years now, I can tell you fluoride is definitely a topic that deserves a closer look.
Okay, so let's unpack it.
Do it.
Before we get into all the details, the benefits, the risks, everything, let's just start with the basics.
Yeah.
What even is fluoride? I read in one of these articles, it's a mineral. Is that right?
That's right. So, fluoride is a naturally occurring mineral, and you can find it in rocks, soil, water.
Okay.
It even shows up naturally in some foods.
Huh.
But the reason it's added to things like our water and our dental products is because of what it does for our teeth.
Okay.
It strengthens our tooth enamel, so that hard outer layer that protects your teeth from cavities.
So it's like reinforcing the walls of a fortress,
Yeah,
making them stronger against attack. Nice.
exactly.
Okay.
When we eat like sugary or starchy foods, the bacteria in our mouth, they feed on those sugars and they release acids. And those acids can wear down the enamel on your teeth, which leads to, you guessed it, cavities.
Right.
But when fluoride is there, it actually becomes part of the enamel, making it more resistant to those acid
So
attacks.
it's not just blocking the attack, it's like making the wall itself stronger.
Exactly.
That's fascinating.
Yeah.
But then that kind of brings us to this whole debate, right?
Yeah.
Because some of the articles that you sent mentioned concerns about getting too much fluoride, especially as a kid.
Yeah.
Something about dental fluorosis.
Yeah, you're right. That is a concern, and it's something we should definitely talk about.
Okay.
So dental fluorosis happens when children consume too much fluoride while their teeth are still developing, and it can cause white streaks or spots on the enamel, which, usually it's just a cosmetic thing, but it is something to be mindful of. Yeah.
And I think this is where the idea of too much of a good thing comes in.
Right.
Just like with anything else, the key with fluoride is balance. Enough to be beneficial, but not so much that it causes harm.
Okay, so too much fluoride while teeth are forming, like, that's a no-go.
Right.
But what about the rest of us? Like, we've all heard those rumors about fluoride being linked to other, more serious health problems.
Yeah.
One article even mentions skeletal fluorosis, which sounds kind of scary, honestly.
Yeah, let's clear the air about that one.
Okay.
Skeletal fluorosis is a real condition, and it can be serious.
Okay.
It happens when there's too much buildup of fluoride in the bones over a really, really long period of time.
Huh.
But, and this is a big but,
Okay.
it's extremely rare,
Yeah.
like extremely rare, in places with controlled water fluoridation.
The cases that we do see tend to be in areas where the naturally occurring levels of fluoride in the water are much higher than what is considered safe. And even then, it takes years and years of drinking water with very high levels of fluoride to develop.
Okay, so it sounds like skeletal fluorosis is really unlikely to be a concern from drinking, fluoridated water in most, like, developed countries.
Right.
But what about some of the other concerns that have been raised?
Yeah.
The articles mention things like brain development, thyroid function, even bone health. Are those things we should be worried about?
They're all valid concerns, and it's important that we address them head on.
Okay.
But to really understand them, we need to, dive into the research.
Okay.
And that is something we're going to do after a quick.
All right, sounds good. So before the break, we were kind of starting to unpack some of those bigger concerns that people have about fluoride,
Right.
especially like those potential links to brain development, thyroid function, and bone health.
Mhm.
I know I've seen those headlines, and it definitely makes you think twice.
Yeah, and I think it's important that we don't shy away from those questions. But
Right.
when we're talking about scientific research, I think the most important thing is to look at the whole picture,
Okay.
not just the headlines that, make you want to click.
Right, right.
So, for example, you mentioned brain development, and there have been some studies that show a correlation between higher fluoride exposure and lower IQ scores in children.
Yeah, and I actually remember one of the articles mentioned this, like correlation versus causation, right? Can you maybe explain that a little bit more?
Of course, yeah. So Correlation just means that two things are happening at the same time. It doesn't necessarily mean that one is causing the other.
Okay.
So, think about it like this. Ice cream sales and crime rates both tend to go up in the summertime.
Right.
But that doesn't mean that, eating ice cream causes crime, right?
Right.
There's probably a third factor there, like the warmer weather, that's influencing both.
Okay.
And it's similar with these fluoride studies.
So just because some studies show like a link between fluoride and some of these health concerns, it doesn't mean that fluoride is actually the the bad guy.
Exactly. And it's important to remember that a lot of these studies were done in areas with naturally high fluoride levels, which are often very different from the controlled levels that you would find in a fluoridated water system.
Right.
And, plus, these areas might have other factors at play, like socioeconomic conditions or access to health care,
Yeah.
that could also be impacting those health outcomes.
So it's almost like you're trying to solve a mystery and there's all these different clues, but fluoride may not be like the smoking gun.
Precisely.
Okay.
Now, in terms of thyroid function, that's another area where some research suggests there might be a link with fluoride.
Okay.
Your thyroid is responsible for making hormones that regulate your metabolism, and there have been a few studies that show that high levels of fluoride might interfere with that process.
And I'm sensing that word might is doing a lot of heavy lifting in that sentence.
It is, because, again, a lot of these studies were looking at really, really high levels of fluoride, like way beyond what you would find in, a glass of water or a tube of toothpaste that you would get in most developed countries.
Right.
And even then, the findings were often very subtle changes in those hormone levels, not necessarily full-blown cases of hypothyroidism, which is an underactive thyroid.
So
Yeah.
not quite as scary as those headlines might make it sound.
Right. It's kind of like the difference between, noticing that your gas tank is a little bit lower than usual versus running out of gas completely.
Right.
One is something to just kind of keep an eye on. The other one's a much bigger problem.
That's a great analogy.
Yeah.
So we've talked about brain development, thyroid function. What about bone health? Because I know one of the articles mentioned something about fluoride and bone fractures, which seems a little counterintuitive, honestly.
Yeah. So this is another one where context is everything.
Okay.
At normal, healthy levels, like the levels of fluoride that you find in fluoridated water and in most dental products, fluoride can actually be good for your bones.
Really?
It can actually help strengthen them and make them more resistant to fractures.
Wow. Okay, so fluoride can make bones stronger.
It can,
Okay.
but, and I bet you can see where I'm going with this,
Cool.
at extremely high levels, again, like the levels that you might find in some regions of the world that have naturally occurring fluoride in the water, it can have kind of the opposite effect.
Okay.
So instead of strengthening bones at those high levels, it can actually weaken them and make them more prone to fractures.
So it really is all about the dose, like so many things in life.
Exactly. It's all about finding that sweet spot, enough to get the benefit without overdoing it.
Right.
And, it's worth noting with those bone health studies, most of those were focused on older adults, people who are already at a higher risk for bone loss and fractures.
So not necessarily as applicable to like younger people or children.
Exactly.
Okay.
More research definitely needs to be done to see if there are any risks at lower levels of exposure, especially in those younger age groups.
All right. So it seems like the main takeaway here is like nuance.
Mm-hmm.
That, fluoride, like a lot of things, has its pros and its cons. And to really get it, you kind of have to look beyond just the surface level.
Couldn't have said better myself.
So we've really gotten into the weeds with the whole science of fluoride, looked at both sides.
We really have.
And I think we can agree it's not as simple as just good or bad.
Right. Absolutely not. It's much more about understanding how it can be helpful, knowing the potential downsides, and then making choices that make sense for you.
Which actually is perfect because one of the articles mentioned some tips for how to do that.
Okay.
Things like, knowing where your water comes from, talking to your dentist. Like, what are some other things folks should keep in mind if they want to, like, make good choices about fluoride?
Those are already great places to start.
Okay.
If you're on a city water system, chances are it's probably already fluoridated.
Oh.
But it never hurts to check, with your city or look for water quality reports online. They're often public. Now, if you have well water, that's a different story.
Okay.
Super, super important to have that tested for fluoride, especially if you've got little ones running around, their teeth are still forming.
Makes sense.
Yeah.
What about those fluoride treatments you get at the dentist? Is that like a everyone needs it kind of thing, or should you talk to your dentist?
Honestly, that's a conversation to have with your dentist because everyone's different.
Right.
Your dentist knows your risk for cavities, they're thinking about your overall oral health, any other sources of fluoride you have, and then they can make a plan that's actually right for you.
So it's like a custom-tailored suit.
Exactly.
Okay, I like that. You want that perfect fit.
Exactly. And never be afraid to ask questions.
Right.
The more you understand about it, the more you can be confident in the decisions that you're making for yourself.
Love that. Knowledge is power. Right.
Always.
Well, we've definitely gone deep on this topic today.
Deep dive for sure.
We learned fluoride is this natural mineral, and it can be like a secret weapon against cavities.
It can.
But like we were saying, it's all about balance.
Always.
Understand how it works, be mindful of your needs, work with your dentist.
Couldn't agree more.
This deep dive, hopefully you feel like you've got all the info. But the question to think about is, how will you approach fluoride going forward?
That's a big one.
Will you be like seeking it out in your products or maybe taking steps to minimize it? It's a choice you got to make, but at least you've got the knowledge to do it.
There you go.
Until next time, keep exploring, keep asking those questions, keep diving deep.
And we'll be here with you.